The following portion of Daytime is sponsored by Bassin Center for Plastic Surgery. Welcome back, everyone. In today's society, we all want to look our best, but sometimes no amount of exercise can change your shape.
For millions of people, plastic surgery has been the answer. However, certain procedures come with serious risks.
Our next guest is able to create positive results by transferring your own fat from one part of your body to another part, making cosmetic procedures a lot safer.
Please welcome Dr. Rigo Mendoza from the Bassin Center for Plastic Surgery. Welcome to Daytime.
Yes.
Thank you.
Now, what makes your procedure different and a little more up-to-date than some of the older procedures?
Basically, Aqualipo, which is the way we do the liposuction portion, it's much gentler. We do it under local anesthesia, and we're able to harvest the fat in a much gentler procedure. We use a power, like a body spray or water spray, and it gently removes the fat, and it's much quicker recovery, and the fat is more viable, so we can use it in other parts of the body.
And what parts of the body are people coming in for most often?
Most common areas is the face, for when you get the indentations and nasolabial folds and what we call the marionette lines, but we'd also use it for the breasts and for the buttocks to increase the shape.
So you take fat, say, from my hips or my stomach, and if I say I need a little fill up here, you'll take my fat and put it in.
Correct, exactly. It's like transferring your fat into areas you don't want it to areas you do want it.
Wonderful.
Okay,
well, there's a shot right there.
Much improved. Now, what's the time difference between one photo to the other?
Most of our pictures that you'll see are about 6 to 12 weeks post-op.
That's fantastic. Is it one procedure or several?
One procedure. Usually this is done as an outpatient. To do an area like this, like the abdomen, will take about an hour.
And, okay, so there's an afternoon, and you say you could be back at work the next day or the day after.
Yes, definitely the next day.
Whoa, and you're awake through the whole procedure?
Yes, we do it under awake, just on the local anesthesia, correct.
And the pain is very, very minimal as well.
Majority of our patients only take extra strength Tylenol afterwards and don't require any narcotics at all.
And a lot of facial work is also being done this way as well.
Exactly. We do all our facelifts the same way.
That's a huge difference.
Well, let's take a look at, wow, now tell us what you did for her.
Basically, we took fat and it was used into the nasolabial folds here to fill in the depressions. You see, it just rejuvenates the face in a simple 15 minutes versus having to do a full facelift.
Those marionette marks, boy, they've gone away.
Yeah, in 15 minutes, you made her 15 years younger.
Yes, absolutely.
Her too.
Oh, my gosh.
Now, how long will that last, though, doctor?
The fat, once we transfer it, it's permanent. Once it's revascularized, it stays there like natural fat anywhere else in your body.
Huh. All right. Wow, that's incredible.
Now, you say it's mixed with water. Is the water also mixed with saline, a saline solution?
Well, it's a saline solution that we use to wash out the fat, and when we're going to transfer the fat, it goes into a sterile canister that separates the fat from the water.
I see.
At the end of the procedure, we take out the fat into sterile syringes and inject it.
Now, up until now, most people thought breast implants, they thought, okay, it's either going to be a saline solution or a silicone breast implant, but you can use your own fat to fill in the breast as well.
Correct. That's becoming one of our most popular procedures now. We call it NaturalFill to the breast.
And it's not even necessarily for enhancement, but also just for balancing if one breast is smaller than the other.
Exactly, we do it for that. Most commonly, a lot of women lose fullness after pregnancy or as they get older in the upper part, so we can reshape the breast, not necessarily just making them bigger, which you can't do with implants.
Right, but you say you can't go from an A to a double D just with the fat transfer.
No, not in one sitting, but like I said, we can shape the breast better. We can usually get up to about a cup bigger if that's what's desired.
In breast augmentation, where would the fat be taken from?
Depends where the patients have it. Most common areas, the abdomen, the hips. You can use the thighs.
What about the fellas coming in for the Aqualipo? Where are they getting it from?
A lot of times the abdomen and the love handles.
Right, those darn love handles.
Doggone those things.
Pretty much impossible to get rid of. Dr. Rigo Mendoza, thank you very much. For more information, call 813-872-7800 or
visit aqualipo.com today to get your consultation. Dr. Mendoza's revolutionary procedures will give you the beautiful look you seek naturally, so don't go away. Daytime will be right back.
Thank you.
The preceding portion of Daytime was sponsored by Bassin Center for Plastic Surgery.